Question that I often get is my leg pain coming because of what's going on in my back? Or is my back pain related to something that's causing pressure on the nerves that go down into the leg? And the answer is possibly. There's an element of actually being able to determine what the cause really is, and sometimes we do that by testing, whether we're doing we start off by doing postural tests and then go into orthopedic tests, or essentially tests that to a degree provoke the nerve but not so hard that it makes it a lot worse. And the other aspect is you can actually have pressure of the lower back in the sense of having a disc problem that's putting pressure on the nerve and going down the leg. That can happen. We can test that out. But then there are some times when you actually got problems in the hip and the thigh and the leg, which are independent of what's going on in the actual back itself. And that's where we need to distinguish between the two. And having said that, sometimes you can have it in both areas, both your lower back and separately in your hips. So that's a lot of they're the things that we have to go through to work through logic to work out, what actually is going on. And that's something that was happening this week, where someone had come in and previously they'd had issues in terms of they had problems with the disc, and they'd had discectomies, surgery, quite often by a neurosurgeon, where they actually had parts of the disc removed. And so in that instance, having that history, you're always wondering is this happening again? So you have to go through and look at it from a 10,000 foot view way up to see and think about, is it the back causing that stuff that's going on the thigh and the leg, or is it actually coming from the leg itself? So these are some of the things that I go through, and in this instance it wasn't an exacerbation of the problems of the past, but actually in the thigh. And in particular, it depends on where the thigh is. It's being affected in the thigh, but in this instance it was to do with the muscles down the side of the thigh, the gluteus medius, and into the band down the side, the iliotibial tract. So it was really tense, so I had to work through there in a way that was sympathetic to the amount of tension and what the patient could handle. And we're moving forward with that. So working through these different aspects to improve the flexibility of the lower back, but then also through the hips and thighs. If this is something that you'd like to ask about, please get into contact. You can message us or give us a call on 9888 6877. Thanks for watching, and have a great weekend.